Welcome back. David Hertel in for Elias. Well, the Surgeon General of the United States sounded the alarm last year about an epidemic of loneliness. But some say that there are important distinctions to make, including my next guest. Timothy Matthews is a lecturer in psychology at the School of Human Sciences at the University of Greenwich in the United Kingdom. Professor Matthews, thank you very much for joining us this morning.
Hi, David. Nice to speak to you.
So when you hear about this epidemic of loneliness, you draw a very important distinction here, don't you?
Yes, in terms of when we talk about things like social isolation and loneliness, these are two very different things. So social isolation you could describe as the objective state of having maybe few or virtually no social contacts. And that can look a little bit different depending on the age of the person as well. But when we talk about loneliness, that is very much a state of mind. It's an emotional feeling where you're unhappy with the social connections that you have, however many they might be. So people can feel lonely even when they're surrounded by other people. They may feel lonely if they feel like they don't have much in common with the people around them, or they don't feel valued, and so on. So it's a very subjective thing.
So we should be talking about social isolation rather than loneliness right now, because everywhere in the media and a lot of medical experts are talking about loneliness. Some of them, I've heard social isolation, but it's mainly loneliness. So are you suggesting we should just drop loneliness altogether?
No, I think we should really be worried about both of those things, because what the evidence shows really is that both social isolation and loneliness are both risk factors for early death. And, the risk is in a similar ballpark to other known risk factors, such as obesity. So the research is still trying to disentangle the mechanisms through which social relationships can kind of get under the skin and impact health. But it does seem to be the case that we should be thinking about both social isolation and loneliness as potential risk factors.
Okay, and when we look at the population, I for example, I've read a lot about both loneliness and social isolation being particularly prevalent with young men and boys as well. But it's not, are there segments where you see this being a bigger problem?
Historically, I guess it was often assumed that these kind of problems, isolation and loneliness, were mainly things that affected people in the later stages of life. In the last 10 or so years, the research has shown that actually loneliness in particular is very common in young people as well. And I guess potentially part of the reason for that is that both the onset of adulthood and then the later stages of adulthood, these are both periods of a lot of transition. For example, these are times when people are undergoing, life changes that can lead them to lose valuable sources of companionship. So they seem to spike at those two stages of the lifespan.
Can you draw a line between what's going on both the loneliness and social isolation fronts and the growing concerns revolving around the use of social media?
I guess we want to be cautious not to make blanket statements about social media, because I think in many cases, particularly young people, they use social media as kind of an extension of the relationships that they have offline. So it can be a force for good as well as bad. There may be some more vulnerable individuals who use social media perhaps as a coping mechanism for other problems that they have in their lives, or they might encounter negative things online, like they might encounter cyberbullying, for example. Those might be the individuals that we want to be more concerned about. But I think it's difficult to make a kind of global statement about whether social media is a positive thing or a negative thing. It could go either way.
So what are the solutions? Because this is major. This is tied to you said it yourself, physical health, mental health. This is clearly a major societal problem. It's not getting better. So what do you propose in terms of treating this?
Well, I guess the kind of simplistic, kind of intuitive answer would be that facilitating more social interaction would be a good thing. But then that can be easier said than done. And I think the key thing to remember is that each individual is unique, and often if somebody is experiencing something like loneliness, there could be other things going on in their lives, so that each individual will have a kind of complex, unique situation. So there is no kind of one-size-fits-all solution. There are lots and lots of interventions that are being investigated, and I would say that maybe 5 years ago the evidence base was fairly kind of patchy and inconclusive. It is improving now, but I think we need a lot more research on not just what works, but also what works for whom.
For example, in the UK, does the NHS actually tackle this problem? Because here in our healthcare system, we have a nationalized healthcare system here in our provinces here in Canada, and we have a problem. We have a shortage of psychologists, and we're not even close to tackling this issue. In the UK, are there any specific measures that you see that are encouraging?
So in 2018, the UK government launched a national strategy for tackling loneliness in society. And so there was a big surge in research, and a lot of sort of publications came out on how we can measure loneliness and how we can tackle it. And the conclusion of that investigation was something was rolled out called social prescribing. So that is where you go to your family doctor and you are referred to some kind of activity in the community. Whatever it may be, could be like a gardening group or dance group or whatever, just something that creates opportunities for social contact. Now, I think that there is definitely, lots of potential for positive effects of that sort of thing, but at the same time, we also need to remember that some people can feel lonely even when they're in a room full of other people. So I think the evidence base for interventions, I think there is still a lot of work to be done, but I think we are making steps towards kind of tackling the issue at a broader level, and I think it's a good thing that first of all that it's being recognised as a public health issue, and also that in having these conversations, it breaks down the stigma attached to loneliness, which I think is a very important thing.
Really appreciate your insights this morning, Professor Matthews, and your time.
Thank you, Dave.
Timothy Matthews, lecturer in psychology at the School of Human Sciences at the University of Greenwich in the United Kingdom.